Good morning, everybody, and thanks very much for tuning in to another of the Somerset Community Council's live talking cafe. Thank you for coming and meeting all of my colleagues right across Somerset. We're all working hard for you and working hard trying to bring these talking cafes together. So the work, I just want to tell you a little bit about the work that I've been undertaking in Somerset in West Somerset for the last few weeks. It's part of my role as a transport village agent, and that role has been funded by the West Somerset Area Opportunity Fund. And before lockdown, we did have a very different project in mind, and we were working with Becky Brown at West Somerset and Taunton Deane Council to bring a project to enable, I have to say particularly women, to get back to work, to build confidence and to use bicycles to access jobs. Unfortunately, because of COVID, social distancing restrictions, that project was not able to go forward. So a few weeks ago, it was made very clear to me when I was trying to get a bicycle for a client that low-cost bikes were virtually unavailable in the area, and bikes under about £500 were equally unavailable. So therefore, if you were on even a low income, even an average income, I'm going to say, you would have struggled to get a bicycle. This was the week that Boris Johnson was broadcasting, please, let's get everybody walking, let's get everybody cycling, because it's safer than getting on public transport. So for those people who could access work via a bike, I realised that this was the time to move forward to try and get bicycles to enable people to access work, so that's when we started the bike project. So it hasn't just been me doing the work, it's been backed up by our amazing Smart Communities team, and that's Jane Birch, whom some of you will probably know through her work with village halls. But we have been working tirelessly to collect bicycles. So first of all, Tamina, who's part of our team in the office, did some absolutely amazing advertising right across Somerset, and many people wrote and phoned in to say that they would love to donate bikes to the project. And we set about then writing back to everybody who had written in and organising. First of all, a gentleman called Mark Townsend went out and rounded up with about 56 bikes, predominantly from West Somerset. Some of them were fairly inaccessible, they were right on the moor in Exmoor, and he rounded up all the bikes, which was quite a logistical piece of work. We did ask for good quality bikes because, as you can probably all imagine, the kind of time and money that you would have to put into renovating something that was fairly dilapidated wouldn't be affordable for us as a charity. So that was the first part of the project, getting those bikes in. And subsequently, a gentleman called Barnaby, he is part of Minehead Merlins, who are a fantastic cycle club in Minehead, has brought in us a further 13. So Mark Gibbs, who works for Exmoor Bike Repairs in Minehead, has very kindly stored this huge number of bicycles in his shed. And also my colleague, when we didn't have enough space, my colleague Mark Shields stepped in and, working with the old hospital, provided us with some storage space there. So that was the first part of the project, rounding up all those bikes. And I have to say, it was very, very touching indeed, hearing the stories of the people who were giving the bikes and the people who said to us, I've just been waiting to do something to help. I am so happy I am able to help somebody who needs to get to work, who's struggling with mental health, who's a young person, that I can help them. I've been waiting all these months. So that has been a remarkable part of the project in himself. And even Mark, who went out to collect them, he felt quite humbled by the whole experience, that the bikes had stories and that the people who were giving them felt that this was an opportunity to do something really positive. So that's been a wonderful part of the work so far. And thank you so much to all the generosity of those people right across West Somerset, and some of them haven't been in West Somerset. They've been in Shepton Mallet. There's a gentleman in Ilfracombe absolutely determined to give his beautiful Dawes bike to us. So thank you so much to all those people, and there are still bikes coming in now. So that's absolutely wonderful. So the next part of the project was to match, who needs the bikes is obviously the question. And then once we had the bike recipients, how do we match up a bike to the recipient? So height, very important to get the right frame of bike. What are they going to be using the bike for? Because what I did was to write out to Claire Pound at Home Start, the manager of Home Start, the charity which does a wonderful, wonderful job supporting vulnerable families in West Somerset. And I also wrote out to Sue Burt, that's the Parent Family Support Advisor in West Somerset. And I said, are there any parents who need to get bikes? And so they have sent me in, or rather their clients have written in to me and asked for a bike. So those bikes that we received, we matched the bike to the person. No point giving a small bike to a very tall dad. And many of those bikes have gone out now. So that's been fantastic, and thanks so much to Claire and Sue for sending in families and individuals. Quite a lot of rurally isolated mums who really needed to get around, mums who want to have a bike seat on the pack, mums and dads whose kids have got bikes because they've prioritised the kids and they haven't got bikes. So this is giving families a fantastic opportunity. Over these summer months, it's very tough. In West Somerset, like in the rest of Somerset, so many organisations have been working hard before COVID to support families with wonderful activities, and I know some are taking place, but not at all to the level they should have been taking place. And the ability now for the families who've received the bikes to go out on the cycle tracks, especially that the Steam Coast Trail have been working on, is going to make an absolutely huge difference to those families' lives over the summer. Just even a couple of miles, if it's on the mineral line from Watchet to Willerton, if it's from Watchdoe to Dunster, that's giving an opportunity for a really special family experience. So thank you for those people who've donated the bikes. Some of the other people who've received the bikes through Donna Archer at the YMCA are a group of young people, and it's an absolute privilege to be able to go over and hand over those bikes. And Donna herself is going to be taking out some young people with the bikes that we've donated. So again, it's giving an opportunity which otherwise they wouldn't have had. Some of the other people who've received the bikes have been young people trying to access work where they felt unsafe, or they haven't been able to get to work, and have been very concerned about doing so. A along either dangerous roads, not having the ability to buy a car. So they're another group of the recipients. Lots of young people have received the bikes, and they're really enjoying and delighted that they can get to work. So a lot of those young people were key workers and have helped us all during the crisis. I've had a young guy I gave one to last Thursday, and he has been housebound due to a chronic lung condition over the whole COVID period. So what that bike has given to him is absolutely incredible, that he's going to be able to build and regain his physical strength now and his mental strength. It is absolutely wonderful. So some of you might have seen on the social media, some of the other people who've received the bikes are members of both Watch It and Willerton Hospital and Minehead Hospital. So quite a large number of bikes have gone over to workers at both the hospitals, who are now able to safely cycle into work. So that is fantastic. And then a number of the other bikes have gone out to carers and micro providers. So micro providers, if none of you know what they are independent, self-employed, insured, DBS individuals who work in the community caring for others. So they have been working very hard, like the other carers who've been working in care establishments. They've been working very hard during these last number of weeks. So again, it's been a great privilege to give those individuals bikes to enable them to get to work safely. And a lot of them, all of the recipients, I've got to say, we've all been very frayed. We've all been feeling a little bit low. We've all been feeling a little bit anxious. So the ability for bike riding and accessing the countryside is absolutely wonderful. So we can build back and strengthen our mental health, having us all been through this incredibly difficult time. I hope I have covered enough and that you understand where we are with the bike project. So those bikes are still going out, and I'm going to say thank you as well to Minehead Merlins. They are now stepping in to pick up some of the other bikes, and I will be having discussions with them to how they can get involved. So that's a really wonderful outcome. I'm also just going to tell you one lovely little story of some bikes that went out to a family last week. And as I approached the house with my car, with the bikes on the backs, a gentleman said, "What are you doing?" I said, "I'm delivering bikes to this family." He said, "I wonder if the kids need bikes," he said. He said, "I've got 2 bikes. I wonder if they'd like me to help them with the bikes that I've got here." So I duly went in, knocked on the door, stood outside. Of course, this is the protocol we're all following. And I spoke to the mum of the family, and I said, "Your neighbour over here would like to help you with children's bikes. Do you have children's bikes, as well as these 2 that you and your partner are getting?" And she had thought she was going to be given bikes, and no, she didn't have bikes. So what a wonderful piece of it. That's part of the spontaneous generosity of the project. I think the whole project that they encapsulate, and he was absolutely delighted, this wonderful neighbour who spontaneously offered to renovate his old children's bikes to give to the family. So again, thank you to that wonderful work. So the other thing that we've been looking at in West Somerset, and this has been going on across other parts of Somerset, is looking at the car partnership teams, because transport teams. So those community car schemes in West Somerset I'm going to say they have been the backbone. These volunteers, they've been the backbone of West Somerset. So until March this year, they were transporting people to important medical appointments, they were taking people shopping, they were taking people to hairdressing appointments, to access things like the fantastic Age UK balance classes that they delivered, and really giving people, quite often it could have been the only person they had seen in that week. So the community car schemes have always historically done a remarkable job. The kind of people who are involved in them, very compassionate, socially minded people. I've been in situations where I can remember a time when I visited a couple. They both had very poor cancer diagnosis, and they hadn't heard about the community car schemes. One of the partners was desperately worried about how the other partner were going to manage, and on that occasion we phoned Stogo, the Stogosi car scheme, and the lady on the end received the phone call in a very caring, supportive way, and it immediately gave that lady in a tragic situation some fantastic support. So the community car schemes, as I say, have been doing an amazing job up until March this year and the lockdown. So here in West Somerset, Jean Humber and David Croxton have been starting to look at how to safely transport people moving forward. So we have had a virtual meeting. Both myself and Nick Margeson from Somerset County Council had a meeting with 8 of the groups from West Somerset, who are highly intelligent, dedicated individuals who totally believe in what they're doing. So we're looking at how we can move that forward now. We're looking at things like seat covers. The Community Council are going to purchase some seat covers for the car schemes, because of course that's very much very important in terms of giving you the ability not to have to clean out the covers if you can simply sort of put them in the washing machine each time. So I was just going to say, for any of you who do have a car scheme who want to advise any car schemes in your area, the CTA, there is a Community Transport Association, and they have an excellent document if you would like to pass that on to any of the car schemes that you've worked with. So they've got details of examples of risk assessments, how you might, for example, gently suggest to someone that, you know, is it an essential journey? Because unfortunately, because a lot of the car scheme drivers were over 70, the numbers of people moving forward who may be able to help are going to be very reduced. So although I do think if we did some appropriate advertising, I do think there are younger members of the public who would come forward to help. However, it is a tricky situation that has to be carefully managed with appropriate risk assessments, and we in West Somerset, we are just at that stage of very carefully looking at risk assessments, appropriate PPE, whether or not car shields could be part of something that's necessary or not. So that work is going on. I have to say, meanwhile, if you are in a desperate situation and you do want to get somewhere, I would suggest calling your local village agent, because a lot of micro providers across Somerset do have appropriate PPE. They do have, well, they all have appropriate PPE if they're working. Sorry, I'll just qualify that. But they are very aware of the situation in their cars. So some of them do transport people. They would be supporting you, enabling you to get to a hospital appointment or wherever you want to go. And obviously you would have to pay them. This is not a community car scheme. It's not a voluntary thing. But it's great to know that that option is there. That they will have the seat covering, they have the anti-bac spray, and they have, you know, they're really done a lot of work. They're very on top of that. So I think at the moment that is an excellent option to go for if you are really stuck and you don't have a family member who can take you. So that's part of the work that's going on with us.